introduction. Good morning from San Francisco. Thanks again to Drs. Ruth Chen and Teresa Chen for this opening keynote invitation. And as you heard, my name is Alvarez, and I'm the Director of Wellbeing at Stanford University Medicine. On December 19, last year, a few days before my highly anticipated vacation with my family in Colorado, I started feeling body aches after a day of hiking with colleagues. We were celebrating the closing of 2021. I didn't really think much of it. I thought maybe I was just not fit enough to do that much hiking. But by nightfall, I was shivering. My head was pounding and I felt congested. I have been hearing about Omicron, and as an emergency physician, I looked back and convinced myself that I could possibly not be infected. I did everything right, including being triple vaccinated. Maybe it's just my muscle breaking down, but what about the chills? And so I isolated myself starting day one of symptoms. And by day two, I still could not get myself to be tested. Partly ashamed, it was as if getting a positive test would mean that I too am now like them. But I have been good, as if this is any bearing towards contracting COVID-19. And so I focused on a short-term goal, which was having that much anticipated vacation in 3 days. The relief of that thought was fleeting. My mind started racing. I can get my family sick if I go. How about the people on the plane? And so I woke up early on day 3 to drop off my PCR test, which meant really driving an hour to Stanford with all the headaches and the chills and the body aches. I took 2 tests just to be sure, one by mail, and then the other I dropped off at the hospital. I texted my family about my symptoms, and I spent the rest of the day at home, isolated, waiting. I received no news that day, nor did I hear back on day 4. I was miserable, physically, emotionally, and mentally. Testing sites were so overwhelmed. I didn't have rapid tests easily available to me. And the turnaround time for the results then was a couple of days. And because of the initial surge, the numbers were rising. And so having finally gotten the test, though, offered me a sense of relief. At least I will know. That same afternoon, a good friend of mine who I had dinner with 5 nights ago, a fellow emergency physician, she texted me that she was feeling some sore throats, and then she took a rapid test, which came back positive. And so could it be? And so now I am more sure. I could have asked my friends sooner if they had any symptoms. I could have asked my colleagues whom I went hiking with if they had any symptoms, but I didn't. I could not. I was ashamed that I may have exposed them and that I would cause them to miss their family during Christmas. The time I had isolating offered me some space to reflect, to ponder, and to rationalize the what ifs, the shoulda, coulda, wouldas. And so at midnight on day 5 of symptoms, the first of the 2 tests came back positive. I woke up later that day to a few more missed calls from the hospital confirming that the other test that I took was also positive. Unequivocally, I contracted the COVID-19 virus that has killed so many and has upended the way that we've lived over the past 2 years. The thought that I may have gotten others exposed was weighing on me. And so armed with confirmed tests, I overcame that guilt and shame, and I started texting colleagues with whom I was in contact with over the past week prior to my symptoms, alerting them of my positive results. I got COVID and it was not fun. I had all sorts of emotions, anger, frustration, sadness, and all the while experiencing terrible headaches, body aches, and chills. But for every ounce of trepidation, there was this significant relief whenever I heard back from them. They had no symptoms. So many of us have been vigilant about this virus. We washed our hands, masked up, socially distanced ourselves. But with the latest COVID strain, transmission rate just seems to be a lot higher. As physicians and healthcare workers, we find ourselves as caregivers, yet also in positions where we are receiving care. We've found ourselves mourning during times of celebrations. We found ourselves angry at someone we love and we care for deeply because of misinformation and decisions about how to handle this pandemic. And we found ourselves hopeful and scared for the future. At Stanford, whenever physicians get COVID, our WellMD center contacts us and checks in with us. I know Julie Anderson. I've worked with her at WellMD, and I did not know how to respond. Then I saw that she also called and left me a voicemail. And I can hear in her voice the mixed emotions of someone who cares and that sound of melancholy. This did not feel good. And I also did not know what to do. The hospital offered me a hotel accommodation if I needed to isolate myself from family members. They also offered a gift box and support. And yet I felt so guilty. I initially thought about not calling back. And I was reminded of this practice of self-compassion and allowed myself to receive the same care that I keep on telling people. And so I called Julie. The kindness and generosity that I experienced reminded me of how good it feels to be cared for when people get sick. I learned that I needed an honest assessment of my own bandwidth. No one could tell me if I was fine or not fine. Many of us are already stretched to our limits now, even if we're not sick with COVID. And so just like me, it's not been an easy past couple of years for the many of us. Recognizing this and showing compassion to ourselves and others, even for a little bit, can go a long way. It certainly helped me. And so that's what my talk here today is, because this includes acknowledging the different emotions that come with getting COVID. I can imagine that so many of us here in the audience have either had it or know someone who's had it. And so I believe that part of our resilience, recovery, and growth require this practice of self-compassion. And I know that this is not very easy for many of us. And yet all the same, it's something that each of us has access to. It requires self-awareness of when we're being tough on ourselves. It also requires the understanding that we're not alone in this experience. And it also requires the understanding that we need to show ourselves the same kindness, the same way that we would extend to our best friend or loved ones. Only then can we truly embrace talking about uncomfortable topics. And so for the leaders in the audience, part of our collective healing is to be able to process our experiences. So it's important that we create spaces that allow us to discuss these tough decisions. Do we go back to in-person gathering? What's our expectations to attend in-person meetings? Do we keep the same amount of meetings that seem to have blossomed during the pandemic? How might we create breaks in between meetings so that we can literally go from one place to another versus those of us from home who just need to switch to a different channel? What about honoring time that is outside the business hours? And so in my role as Director of Wellbeing, these were some of the challenging topics that needed to be facilitated, and we created time and space for this. And what I've learned is that some had solutions and many others, simply just acknowledging that there are no easy solutions, gave us this sense of agency. At least we're talking about it, as opposed to this unrealistic expectations that we have for each other. And yet all the same, it's actually it's untenable. All this to say is that we have to acknowledge our limitations. We simply cannot be in all the meetings. We cannot be productive when we're constantly worried about daycare, canceling on our kids, deadlines that keep on piling up. And all the same, we continue to get exposed to the virus at work and at home. And so we need a break. We've needed a break. Some of us may not have had a proper vacation since the pandemic started. And every month, it's as if there's something more challenging that come up. For us, it's nurses strike, a shortage in equipment, and this doesn't even take into account what's happening globally. The war in Ukraine, the mass shootings. We're constantly navigating trauma and stress. And so talking to people who have experienced COVID firsthand gave me, and myself experiencing it firsthand, gave me that empathy to humanize this experience. And so we decided as a department, we will automatically forgive the first 5 shifts when somebody gets COVID. Now that costs a lot of money, but this gives one that time to recover and also plan for contingency regarding childcare or other non-work related responsibilities that people may have. Now, while this does not solve the problem of COVID itself, it at least gives somebody the time and space to deal with their problems and making their clinical responsibilities one less thing that they have to worry about, especially when they're sick. So this was tested a couple of weeks ago, and several of our faculty, residents, and staff got sick. In fact, our ED has the highest surge in all of Stanford healthcare right now, amounting to over 100 clinical shifts affected, many of which happen within 72 hours. So imagine in one day getting at least 5 emails about someone getting sick, with 4 to 5 clinical shifts needing coverage for each of them. But in as much as this is challenging for us, what continues to give me hope is that people keep on stepping up. And the ones who were sick once they test out of COVID, you start seeing their names in the email thread covering shifts. People were coming up with creative solutions, moving shifts around, sending COVID tests to the hotels where people were staying. Our department bought some bulk orders of the rapid test to give to anyone and everyone in our department with remotely vague symptoms, because the sooner we find out that they're sick, the sooner we can deploy contingency plans like getting coverage again. And also, we let the hospital leadership know about what's happening in our department. You see, before, we would just figure things out and make it work because that's who we are as emergency physicians, right? Then I remembered in the past couple of years overhearing people saying that the hospital doesn't acknowledge our work. And so this time we learned to advocate for ourselves better. Beyond emails of acknowledgement from the CEOs, the hospital sent out gift cards, not only to those who were sick, but also to those who stepped up and picked up shifts. I know that they're not a lot, but I also remembered that receiving a surprise gift does mean something. It was also important to create a team that would check in with those who got sick to remind them that they're not alone. While the institution already had something in place, like having the Julies at WellMD, our department also created a team whom people can reach out to, where we have a list of resources available, easy for people to access. And in fact, WellMD has found that it's not until a week later out of the symptoms that people start feeling more overwhelmed. And really, our role in this team is to simply acknowledge to our fellow members in our department that it's okay to feel crappy. It's okay to feel guilty. It's okay to feel like this sense of being a burden to somebody else. And to remind them that they're not alone and that we're all in this together. We also try to celebrate wins, even the small ones. So just as we were getting inundated with emails about yet another one getting sick, we were publicly acknowledging people who were stepping up. It created this sense of community in the department. People were feeling that we care, even though many of us may not have seen each other in person in over 2 years. We would even send emails about like, as of right now, all of our shifts are covered. Just little wins. That was a source of hope. We had to remind ourselves that everyone is struggling one way or another and to extend some grace, however that may be. and to also just find time to rest, hydrate, and even do nothing, even if it's just for the time that we're healing and recovering. Because I know that when I was sick, I tried to do so many things and it was unrealistic, because there's the brain fog that you're experiencing, there's the body aches, and there's again that constant barrage of guilt and that shame that you're experiencing. And there's no need to start thinking of writing your paper then. And so our group was created to remind people that each and every one of us is simply doing their best. And so to close this, I hope that by sharing our experiences with COVID, that you can also learn from me in our department, that hopefully you too can normalize to our fellow healthcare workers all the emotions that come with this surge, that while some of our efforts cost money, reaching out and acknowledging those mixed emotions, celebrating those wins, those do not cost a lot. And so with that, a true heartfelt thank you for all of you that do all this work and all the work that you do. And also thank you to the Julies in this world. Each of us has that capacity to be a Julie for someone else. And so I hope you know how much I appreciate you. So thank you.
Thank you, Ale, for your opening plenary. We have some time for questions. So if anyone wants to turn on your mic or enter a question in the chat box, I can moderate the chat box as well.
Hi, lovely to meet a fellow Emerge doc. I worked for 10 years in Hamilton. Just a question about the context of this. When you're talking about a Stanford hospital system, you're talking about the university or the actual care delivery, or both?
So in terms of the number of COVID cases that's affected, I'm talking about the physicians at Stanford. As you may know, our hospital is, the faculty is under the School of Medicine, and the residents and nurses are under Stanford Healthcare. And so for all of those combined, our emergency department right now has the highest number of members affected by COVID.
Any other questions? We have Helen here in the chat box saying self-compassion. Thank you for that. It's a good reminder.
Yeah, and it's also very hard to do. I can honestly say that we're usually very tough on ourselves.
I really appreciated your vulnerability in sharing some of your own feelings as you were navigating those initial stages. Bill, I see your hand up.
Yes, thanks very much, and thanks for that, Dr. Alvarez. I must say, as you went through sort of your different steps of, shame, duality, compassion, I was reminded of kind of Elizabeth Kubler-Ross's 5 stages, and getting to that final stage of acceptance. The question I had bears on sort of the importance of relationships,
Yeah,
and building resiliency. There's a lot of literature on the fact that resiliency is kind of like a muscle, and it can be built up by establishing and reaching out to trusted relationships,
yeah.
both individually and organizationally. So can you maybe expand on that part of your talk, and especially the part about what kind of strategic alliances and partnerships maybe your organization formed to try and get your group through this, as opposed to just get you through this?
Yeah, thanks for that question. And so really the question is, how do we develop resilience as an individual and also as teams, and how does connections and relationship play into developing this resilience? Did I capture that?
Yep.
Yeah, so I think as an individual, in my work on compassion, it really is hard to develop resilience if you're not kind to yourself. And so part of being kind to yourself is being able to understand which is within your control, which is not within your control. And so setting those boundaries and also being kind to yourself when you're not able to do more because you're tired, you're sick, is really important. And I think as part of the team, we need to acknowledge this. It takes leaders. So I think share their vulnerabilities, which is what I try to do. And also beyond just sharing vulnerabilities, which can be manipulated, really creating concrete things. Like, we know that it's terrible to feel isolated when we don't have family members. And all the same, if you have family members, it also does not feel good when you have to split up with taking care of your kids and who else is taking care of your loved ones who are not sick. And finding ways to support this, I think, is very helpful. So for us, it's beyond just like calling them and checking on them, and really like helping them get that hotel, helping them like navigate the multiple phone calls that they may have to do to find the right place to move. And also what I've found over the past year especially is that several of these do not have good answers, do not have good solutions. Like, how can we provide childcare when everybody is sick and you don't really want to expose somebody else to be sick as well? And so at least talking about it created this sense that that one person who has kids is not alone in this, and that perhaps like the parents, the caregivers can talk amongst themselves and find what works for them, or even reach out to each other if somebody else is sick. I think that is one way that we can develop resilience as a team, as opposed to that individual expecting somebody to just resilience their way out of this. You cannot, right? And so I think as an institution, as a department, we can create systems that take care of each other.
Thank you.
Yep.
Thank you for that question, Bill. Sandra made a comment in the chat box here. Dr. Alvarez's experience reminds me of Nell Nodding's ethic of care, and the importance of acknowledging the reality of those that are cared for, i.e. our patients, can just as easily become the reality of the caregiver at some point in time.
Yeah, and we also protect this identity that we're caregivers. And so it's so hard to actually receive that care when the roles are flipped. And so I definitely felt that. And I figured if I felt that, and I'm more attuned to this, like I can only imagine how many more of my fellow colleagues like were experiencing this. And so the more I talked about this, the more people would say like, I totally get what you were saying. And I still feel guilty right now, even talking to you, because I don't want to waste your time. Right? It's helpful to be in a department where there's people actually dedicated to just do this work, as opposed to that sense that you are wasting people's time when you're reaching out.
And I'll alternate between those hands that are raised and the chat box. So Conrad, I see your hand up, and not sure if you have access to your mic because I noticed that there you go. Great.
I am at a stoplight, so your timing is perfect.
Okay.
So I'm very sorry I missed the presentation. I was doing patient care, but I'm curious about the following thing, whether you covered it or not, Doctor. Because it occurs to me that the very part of our psyches as high-functioning medical professionals, whether physician or otherwise, that has allowed us to become that and achieve so highly, for me at least, speaking for myself, and I know for some of my other colleagues, that is intimately tied to sort of a sense of inadequacy, in the sense that I'm inadequate on some deeper level, maybe some childhood level. So I have to try really, really hard to succeed or achieve or get that A+ or get that A to get into school, to get through school, and so forth. And then when faced with a situation of vulnerability, or one that triggers the same shame that comes from the same place, that it can be very difficult for high achieving people to deal with that and to cope with that, and then to do the kind of journey that it sounds like you described in your presentation. So I'm wondering if that came up, or whether it did or not, if you could say something more about that. Thank you.
Yeah, so what I'm hearing is that how do we balance this motivations of fear, because it got us to where we are now, right? If we did not care, then clearly we would not have pushed ourselves to excel and get A's and do all these like amazing things that we were able to accomplish. And yet at the same time, it's not helping us right now when we're put in a situation where we have to be vulnerable, when we have to actually recognize that we're just human beings. Did I capture that? I go back to that idea of self-compassion. Kristen Neff, who's done a lot of work on self-compassion, talks about this. She mentions that most of us are motivated by this fear of failure, fear of not being good enough, fear of experiencing the shame that you were describing. And yet, I think that in the short term, it gets us to where we are, but in the long term, we really start recognizing that it's not sustainable. I think that that's one of the reasons why there's this idea of the great resignation, because with the pandemic, people are all of a sudden realizing that I have put 110% of myself in my work, and then I'm seeing not a lot of return anymore because I actually need to start prioritizing my time with my family, my time with my loved ones. And so that alignment or misalignment of goals are much more apparent now. And I think that's the solution is to not quit. The solution is to, again, maybe taking a pause and recognizing that maybe I'm doing this in a much harsher way, and maybe there are better ways for me to be successful, like being kind to myself. Like when I need to sleep, maybe I should take that nap, or maybe I should eat when I'm hungry, as opposed to, I know many of us would skip meals, would skip some sleep, some hours of sleep, just so we can finish that one paper, that one deadline. And perhaps the more we practice this idea of self-compassion, we can set better boundaries that actually help us perform better, because then we're not just chasing deadlines, we're actually doing things based on what we are motivated to succeed.
That's great. Thanks. And I see Conrad giving a thumbs up. I'm not sure if you can see that, LA.
Yeah.
So I'll go back to the chat here with Alice's question and then go to Sean Park. So Alice is asking, and it's in line with your comments around self-compassion and vulnerability that we've been discussing. How do you align or not align empathy and compassion? I see compassion as a behavior and empathy as a feeling. Kind of a challenging question.
That big question about the difference between empathy and compassion. And even sometimes you can hear it like with compassion fatigue. Compassion fatigue is actually, they don't exist, because compassion is something that is within us and we have access to it. Empathy fatigues because it's us putting ourselves in somebody else's position. I guess that for me, the difference is that you don't always have to put yourself in that other person's perspective to extend that compassion to them. And that, I think, is to extend that feelings that you want to support them. And I think that for me is compassion versus empathy, where it can be exhausting when you have to put yourself in everybody else's position every single time. So that simple act of like noticing suffering and then leaning into how might you help them, I think is a way to understand compassion versus empathy.
Great, thank you. And thank you, Alice, for that question. So I'll go to Sean here up on the screen.
Yeah, Dr. Alvarez, really great to meet you. I notice you have there behind you a book. Creative
Oh, we have the same book. It's from the D School.
I'm a D School alum, and I teach human-centered design here in the context of health innovation, and one of the projects that I use for my course actually is inspired by designing well-being rituals for the Stanford AR with the Ritual Design Lab. And so my question really is about rituals and design as a frame for, it's not a system-wide kind of change that we need, but we can change the things that we do when we meet each other.
Yes.
And whether that be kind of on a switch off with a shift, right? Or in some of the ways that you've talked about with your team. And those are sometimes, culturally we have things that we do that are, we just do them because we've inherited them, but there's also this intentionality we can bring to redesigning ways that we meet. And so I'm curious what your, if you have a story or your view on the way in which kind of design and creativity matters in this conversation.
Yeah, thank you. And I love that. And clearly you're an expert in this. I would also add Dr. Eve Purdy is an expert on rituals, and she's also in emergency medicine in Australia. I love designing systems that can alter experiences. So an example that I do is I love food. In my family, food is a great way to connect. And so when I do clinical shifts, I actually bring food to my residents, because not only does it does the meat like something that like they're gonna get fed, it also opens up this curiosity, like, ooh, I wonder what you're bringing. And then people start gathering around. And I know this is the pandemic and you're trying to not gather people. You can still wear masks, but the idea is that it connects people in a much better way than talking about a clinical case, or like talking about like that thing that you need to do for the patient in bed 9, right? If you can at least sit down, or even like if I have consultants like on the phone that are not the nicest, sometimes like one of the things that we do is, hey, do you want to come down? We have food here. So offering some sense of like food as a way to connect, I think is a good way to break that barrier that sometimes we forget, that we're just so focused on the task that we're trying to do. So you're right, we have the ability to design experiences or create rituals that can actually humanize us as physicians, as healthcare workers, as opposed to just falling into our roles and then expecting somebody else to just follow that or understand us. Because like I said earlier, everybody's struggling. And so if you can at least connect with them at a human level, like with food, I think that can bring conversations to a lot more meaning. I certainly look forward to my work much better when I know that I'm bringing food, because then I get excited, especially on those shifts that I'm like dreading. Like I don't know if it's just me, but like there's definitely some parts of the emergency department that I dread working, right? So like I even bring more food then.
So I was going to say, I'm going to be at Stanford at the end of July, and if you're around, I'm going to call you up, and I want to know where the best food is.
Oh, I love it. I love it. And you can ask any of my residents. If there's one thing that they can predictably expect, it's like when they work with me, there's always food.
Love it. Thank you so much. That was
of
awesome.
Of course.
That's perfect, LA. So we have a few comments about food in the chat box here, and I'll just scroll up to a comment/question that's connected from Anthony. Fine presentation, Dr. Alvarez. You mentioned institutional support involving lots of money. Good results are also achieved by interpersonal acts of kindness, as you've been speaking to. Don't you agree?
100%. I think that the money here is just because I take advantage of the fact that I'm at Stanford and we have some access to some resources. But I think that in many of the work that we do, we don't actually involve money, right? So connecting to people, humanizing their experience, I think you don't have to have money for that, right? So for me, yes, for bringing food, for instance, I pay for that. Like the department does not pay for that. But for me, the return of investment is so much better, because then I show up to work happy throughout my shift. People are like talking about the food. And then when I leave, there's a sense of like, we just had a nice meal together, as opposed to I showed up, I saw a bunch of patients, now I have a ton of charts to do. And then tomorrow I got to do it again, right? And so what if I can just ask like, hey, what are we craving for tomorrow night, right? Like even giving the residents option, like imagine that, because they don't always get that choice. And so then everybody gets excited. And I'm a nocturnist. And so I work with them like 6 nights in a row. And so by the 5th night, at least there's still some excitement, as opposed to just like working with them, just like, like it's just so tiring.
That's great. Now we have a comment from Laura. And welcome from Connecting Out East, a link to the video on why you don't have to be exceptional. So this is connected to a few questions ago, which I found interesting. Lara is a psychiatrist and agreed with much of what is said. Sean also posted a link here in the chat. Sean, I don't know if you wanted to describe the link that you posted.
So that's just an overview of the ritual design group that did a redesigned well-being rituals for the Stanford ER. And it really kind of brings in some creativity and describing the process for creating rituals.
Excellent. Thank you. So we have
and I will probably leave you with this video
yes.
because it's inspired me in so many ways about how just simply connecting with people can actually change our relationships and the way that we see things. And so when you're bored sometime today, play that video. I guarantee you it will make you feel like you don't have to be a leader to actually make some positive change. It's simply those like moments that we can notice.
That's great. Thanks for that ending video for all of us to connect with, because that's a perfect segue into our break time here. Part of our intention in planning this conference afternoon was that if our focus is on wellness and growth for the future, then we definitely need to plan a schedule that offers enough breaks in between sessions so that we're not then rushing from session to session. So let me make a transition to our parallel sessions and provide a few instructions. Thank you very much, LA, for your opening plenary. Really excited to have you here, and thank you so much for sharing your wisdom, your experience, and all that you have learned and benefited from, and allowing us to learn from you. So there you go. I send you an
Thank
emoji.